One of the most surprising facts for new Medicare beneficiaries is that their healthcare and retirement is far from free. Although you've likely been paying taxes throughout your working years, those taxes fund only one part of your future Medicare. In this video, I'll explain how much Medicare will cost you in 2024. Each year, Medicare sets its prices on premiums, deductibles, and copays. It's common to see these premiums increase due to inflation and the rising cost of healthcare. In 2024, this is no different. But before we jump into the numbers, be sure to download our free guide at the end of this video that details all of the 2024 costs. Medicare Part A is your hospital insurance. For most people at age 65, Medicare Part A costs nothing. This is because during your working years, most of you paid FICA taxes that were deducted out of your payroll checks to prepay for your future Part A insurance. If you worked for at least 10 years or 40 quarters, or you were married to someone who did, this will qualify you for premium-free Part A. You may also be able to qualify through a former spouse or late spouse who had the proper work history. So 99% of beneficiaries will qualify to pay nothing for Part A, and the small percentage who do can purchase it for $505 a month in 2024. There's also a prorated premium available for people who have at least 30 quarters but not 40. They would pay a premium of $278 a month in 2024. Each part of Medicare also has a deductible that is set each year by Medicare itself. Part A's deductible is per benefit period, meaning you could pay it more than once per year if you have several inpatient hospital stays that are more than 60 days apart. In 2024, the Part A deductible is $1,632. Now moving on to your outpatient coverage, which is Medicare Part B. Part B, unlike Part A, has a premium that you'll pay every month. Social Security will deduct this premium out of your benefit check each month before it even hits your bank account. And if you're not yet taking Social Security benefits, you will get a bill in the mail each quarter, or you can sign up for Easy Pay on Medicare.gov for a monthly auto draft from your bank account. There's a base premium for Part B that the majority of Americans on Medicare will pay each year. In 2024, the standard base premium for Part B is $174.70 per month, an increase of $9.80 from 2023. Most beneficiaries pay just this base premium, but some people with very low incomes can qualify for assistance through various Medicare savings programs available in their state. Contact your Health and Human Services Department for more info on that. And then on the other end of the spectrum, around 7% of beneficiaries will pay more based on higher incomes. We call this the Income-Related Monthly Adjustment Amount, or IRMAA for short. This is just a fancy acronym that could be summed up by saying if you earn more, you're going to pay more for Medicare. And IRMAA currently applies to anyone earning more than $103,000 as an individual or $206,000 if filing jointly on a tax return. There are 5 different levels of higher incomes depending on your modified adjusted household gross income from 2 years ago. So here's how this works. The IRS sends your most recent tax return data over to Social Security every year so that they can calculate your Part B premiums for the upcoming year. Then Social Security mails you a benefit determination letter in the mail to let you know what your premium is based on that tax return data from 2 years prior. People in the highest tax brackets will pay more than $500 a month for Part B. And it's critical to know this ahead of enrolling in Medicare so that you don't have any last-minute surprises. In the notes below this video, I'll include a link to our handy online IRMAA calculator, where you can calculate how much you can expect to pay for your Medicare premiums in 2024. Now, here's a tip for those of you who have recently retired and were earning significantly higher income 2 years ago than you are now. You don't have to wait for Social Security to catch up to you. You can file a reconsideration request to ask them to reevaluate that premium based on documentation that you provide of your lower incomes since you've retired. I made an entire video specifically explaining how this process works, and I will provide you a link for it below. Like Part A, Part B also has a deductible. However, Part B's deductible is much smaller and only paid once annually. In 2024, the Part B deductible is increasing by $14, making your annual deductible $240. Now let's talk about the very popular program for outpatient medications, Part D. There are more than 50 million Americans enrolled in Medicare Part D prescription drug coverage. When you enroll in Part D, you do not do this at the Social Security office. You're going to enroll in Part D by choosing a plan that's offered in your state by a private insurance company. The base cost of these plans is set up by the individual insurance companies that offer them. So these can range anywhere from around 50 cents a month to over $200 a month, depending on where you live and which insurance company is offering the plan. However, the national average Part D premium for 2024 is around $55 a month, so that could be a ballpark figure that you can use in your Medicare planning. Just like with Part B, Social Security can tack on extra premiums if you are in a high income bracket. Premium, though, is not the only consideration. It's important that you do a plan analysis before enrolling. You can determine which plan would be the most cost-effective for you by using the Medicare Plan Finder tool inside your personal mymedicare.gov portal. Here at Boomer Benefits, we run the analysis free of charge for anyone who enrolls in their Medigap or Advantage policy through our agency. It won't cost you a penny, and it can save you hundreds of dollars on your annual Part D spending. Part D also has an annual deductible that Medicare sets every year. In 2024, the Part B deductible is $545. This is the maximum that insurance carriers can set for the deductible. However, they can set it lower if they wish, so you will see plans with deductibles ranging from $0 up to $545. Here's my tip for Part D. The plan with the lowest premium or lowest deductible is not the plan that is necessarily going to be the most cost-effective for you. Why? Because enrolling in the plan with the lowest monthly premium or the lowest deductible isn't much help if 3 of your important medications are not included in that plan's coverage. The reason to use the Plan Finder tool is to see which plans offer the lowest overall annual out-of-pocket spending. This takes all factors into account, including premiums, copays, and everything that you expect to spend on your medications under Part D. If you've watched our YouTube video about how Medicare Part D works, then you already know that all Part D plans have 4 payment stages. These are the deductible, the initial coverage, the coverage gap or donut hole, and the catastrophic coverage stage. Your spending on prescription medications will vary depending on which stage you are in at any given time. For example, you pay all costs for your drugs until you reach and satisfy the plan's deductible. Then you will enter the initial coverage stage and pay just copays or coinsurance amounts for each drug. In 2024, if your drug spending reaches $5,030, you will enter the coverage gap or donut hole, where you will pay up to 25% of the cost of your covered drugs. And if you continue to fill prescriptions and your spending reaches $8,000 in the calendar year, you will enter the catastrophic coverage level. At this stage, you will pay $0 for the cost of your covered medications for the remainder of the year before all of these reset in January. Some people take so few medications that they never even get out of the deductible stage. Others who take more medications, and especially brand name medications, may hit that $8,000 out of pocket. And in 2025, it's going to get better when the legislation will limit your annual spending on covered Part D drugs to just $2,000 per year. So it's fair to say that Part D is far better than having no drug coverage at all, but it will certainly factor into the costs that people need to plan for in retirement. Medicare Advantage plans, or Part C of Medicare, have a wide range of premiums just like Part D plans. There are some plans that offer a $0 premium because they get paid by Medicare to take on your medical risk. Advantage plans also have a maximum out-of-pocket limit to protect you from spending beyond a certain dollar limit on Medicare Part A and B services each year. Once you meet the maximum out-of-pocket limit, or MOOP, your plan starts covering your approved A and B services at 100%. Medicare Advantage plan carriers can set their limit lower but not higher than the maximum out-of-pocket limit that Medicare sets. The maximum allowed is increasing to $88.50 in 2024 for in-network services, and it can be more if you use both in and out-of-network services. Again, some Medicare Advantage plans can and often do set their maximum out-of-pocket limits lower than the maximum allowed. This is great for you because it caps your spending sooner. So be sure to look at the limit each year, as it often changes annually. So there you have it, Medicare's 2024 costs. Now that you've got the cost down, you can start looking at what type of Medicare plan you want to purchase to help lower your total out-of-pocket costs. For some people, Medicare premiums are much lower than they were paying for employer coverage, and for others, it's an unexpected expense. Drop a comment below letting me know what you think about your current cost of Medicare. And if you want to save money on your plans, or you're just getting started and want expert guidance, give my team a call at 817-249-8600, where you will get old-fashioned customer service, the kind of service your parents were used to back in the day. Remember, our help is always free to you, so thanks for watching and I'll see you in the next video.